I was just gonna ask, from the moment you said mammogram, for females out there that is hearing this, how often should they do the mammogram test? But you're saying once a year?
Once a year for somebody who maybe has no history of cancer in the family. But if you have a history of cancer in your family, then you and your healthcare provider, whether you're a doctor or you go to your clinic, can work out a schedule. How often you go to have a mammogram? If you're predisposed to having it, like you're fat, you're over 40 times your body weight, your mother, your auntie, your grandmother, or somebody in the family had cancer, then you'll be more at risk. So you would be more scheduled to go maybe more often than the normal person to have your mammogram done.
We spoke about signs of breast cancer. You told us about the whole lump in the breast. They might feel discharge. They might find out that discharge coming from the breast and so on. Is there any other thing that a female can look for?
No, it goes down to anything abnormal with the breast. So if when you pain is gonna come after.
All right.
Pain usually, if you find a lump in the breast and it's cancer, it's usually not painful.
Okay.
It's usually not painful. The pain with cancer comes when it's far gone, mostly.
You said a lady can do her own examination by standing in front of a mirror and examine her breast. But let's ask a question. She might just say, one, look a little bit bigger. Is this a sign?
No. It's they said the body is asymmetrical, I think is the word, where a part of half of your body normally looks maybe a slightly bigger than the other half.
All right, finally, anything you want to add for people that out there and say, wow, that sounds good and we need to take a check and link up the doctor?
Yes, you should see your physician for annual checkups. And any of the what I listed before, you're over 40 times your body weight, you're over 30, you've never had a child, or you have a child over the age of 30, you have persons in your family who have had cancer, whether breast cancer or a kind of cancer, you should see your physician for your regular checkup. I summarize a few things. Always remember to do your breast self-examination, because study shows that over 90% of persons who found out that they had breast cancer it wasn't found out by the doctor. They found out for themselves. Self-examination. So that's huge. 90% is huge. So in summary, I would say you do a breast self-examination at the same time every month. You have a clinical examination by your doctor regularly. You check for bulging of the skin, dimpling, redness, soreness, rash, swelling. Nipple pushing, the nipple should be outward. So if you notice the nipple pushing inward instead of out, you call it inverted nipple. Pushing inward instead of out. Any signs of discharge or fluid or bleeding, whether it's be watery or milky coming from the breast. You do your regular mammogram and you consult with your healthcare provider if you think you are among the persons at risk that I just listed.
Okay, Shelley, sounding good. And I hope my listeners, they got what they wanted and they can consult a physician.
Yes, it's a lot of information out there, So this is just a summary. They can go do their own, research on it and get more information.
Okay. Thank you very much, Shelley, for passing through.
You are most welcome.
People out there say, where Baker get her from? Guess what? She have whole heap of knowledge, send out the air.
I try my best.
Shelley, have a wonderful day. And, I have to invite you for another topic. Probably we might just look at prostate cancer somewhere early down the road. But we want to say special thanks for you passing through.
Anytime. You're welcome.